Good morning, everybody, and a cordial welcome to today's annual International Forum. I hope you had a good night's sleep and an excellent evening yesterday. And it seems that some people are still fighting with the after effects of that evening. Anyway, we will have an interesting presentation by Krause and Renata Gensicke. And I would like to introduce our presenters, to whom I extend a very cordial welcome as well, of course. Krause is an urban planner working on consensus-based practical solutions for designing urban spaces together with local administrations and civil society. He studied at the Bauhaus University in Weimar, in Germany, and at the University of Newcastle upon Tyne in England. Since 1995, he has been working in the urban upgrading of informal settlements, primarily in the Phoenix settlement in Durban, South Africa, which is the site of the second ashram of Mahatma Gandhi. And Michael promised to explain what that is exactly. Thank you. Since 2006, Michael is leading a very heterogeneous and highly motivated team that continually develops sustainable programs for violence prevention in high-crime urban areas. And this team also implements locally adapted solutions together with people in the neighborhood concerned. Michael is the co-founder and CEO of the NGO VPUU, which means Violence Prevention Through Urban Upgrading, that presently has a staff of some 1,500 people. There's not many NGOs with that kind of a staff. VPUU facilitates dialogues between citizens and officials to develop socially, economically, and culturally appropriate measures contributing to a sustainable and safe neighborhood. Michael provides consulting at the local, provincial, and national level concerning integrated and sustainable approaches for implementing public strategies at the neighborhood level for the benefit of the people living there. Renata has been trained as an educator and finance manager in the non-for-profit environment. She has been working in Tanzania, Botswana, and South Africa. In South Africa, she worked at the Hillcrest AIDS Center in Durban, and for the past 15 years as a financial manager at Violence Prevention Through Urban Upgrading. Okay, I already introduced VPUU. They will be presenting a very interesting example of their work funded by the German Development Corporation and the Bank for Reconstruction in Germany. Renata, Michael, you have the floor.
Thank you very much for coming. It's a great honor to be here. By the way, we're now 2000, by the way. The bio is a couple of months old. So we're currently quite expanding as an NGO or as a non-for-profit company, as we call ourselves. So I would like to take you to a journey to South Africa. We're working in Cape Town primarily. A journey about how to use a crisis for leap forward in early learning, particularly with children between 0 and 6. The story will go a little bit about apples for healthy minds. That's around food relief during COVID. It's around vouchers for a strong body. That's around testing the basic income grant. It's around income to stand up for yourself and your community. That's how we use social work to strengthen the neighborhoods. I've structured it in a couple of elements. It's obviously the context is quite important, the South African context. It's around the frameworks that we work against and towards. It's the impact of COVID, so that we have a little bit of an understanding of what's the impact of COVID, particularly in the South African society, and then how did we start a coordinated neighborhood level response. Many of us will know that inequality is an important risk factor when it comes to interpersonal violence. We also know that interpersonal violence is more concentrated in areas of poverty and deprivation. And we probably also know that South Africa is one of the most unequal societies. with a Gini coefficient of 0.67 and a very large legacy of exclusion. The inequality of wealth is even higher, and the intergenerational mobility is very low, meaning inequalities are passed on from one generation to the next. And that's a big problem in the country. So if you look for the last couple of years, what has happened, the developments, you can see very clearly since 2000, the richer get richer and the poorer get poorer. So the top 10% owns currently or gets an income of 67%, and the bottom 50%, the bottom half, is about 7% of the income. If you look at the income distribution, we can see that the top 10% earns 63 times more than the bottom 50%. So we are in a good company, as you can see, with many developing countries. But that obviously makes that society very fragile when a crisis hits like COVID. I don't know whether people are familiar with the term 40 by 40 by 40 city that we're living in. What that means is that we've got 40 square meter homes, and you see some examples on the screen, which are 40 kilometers away from opportunities, where people use 40% of their disposable income for transport, but we still have a 40% unemployment rate. It's a very, very unequal society, as you can imagine. And it's obviously from an urban planning perspective, there's a big question, are we investing into mobility or are we investing in accessibility? Meaning, are opportunities in a walking distance? The frameworks, many of you will be familiar with them, so I will rush through them in order to get to the emerging impact of COVID. Many of you will be familiar of the triangle from Galtung, with the three types of violence: the direct violence, the structural, and the cultural violence. You may be familiar with the response from the South, from Jayakumar in 2019, saying that actually underlying of all those types of violence is an unhealed trauma. And you can imagine in a society stifled by apartheid, that trauma is a big issue in our society. You will be familiar with the socio-ecological model, so that we do interventions, that we have different types of interventions on the individual, on a relationship, on a community level, and on a society level. And you will be familiar, like it was described at the opening session, around risk factors, and protective tools or measures. What we also spoke, or what we heard at the opening panel, is the current divides. It was framed as crises. You got the climate crisis, which we call the ecological divide. You got the whole question about, are people building the social capital, which is the social divide. But we haven't spoken very much about the spiritual divide. And that's really sort of, it started to come into the conversation a little bit with mental health. But I think there's much more that we need to work on the spiritual divide. So over the years, we have developed a strategy, an integrated strategy that basically got 4 pillars. It got lifelong learning from a prevention perspective. It got the building of the social capital, which we spoke at length yesterday, that talks about cohesion. It's around protection and of safe communities. And it's about creating evidence so that we know what we do actually has a positive impact. Yesterday, there was a couple of throwaway comments about, at least we need to know that we don't do harm with our interventions. We would like to see it actually very targeted, that we know whatever we do have a positive impact, because we don't have the resources in South Africa and possibly like in other countries. All we do is very much linked to the Sustainable Development Goals. And we're fortunate that in our country, we've got a very strong integrated crime and violence prevention strategy with 6 elements, and it's linked to that. Some of you may be familiar with the work that we do as VPUU, violence prevention through urban upgrading. So we go into areas of the apartheid's legacy, i.e. your townships and informal settlements, and with a very consultative process, we turn those very hostile areas into very beautiful areas, into safe spaces of spatial and social transformation that we, through negotiation with our partners, we work towards pride and citizenship in order to have common values. And that's really going into safe spaces, creating and managing safe spaces. The situation of COVID was quite harsh in South Africa. In the first couple of months, on the 10th of March, to my knowledge, the first COVID case was detected in South Africa, so relatively early in the crisis. So by April, about 3 million jobs have been lost. That meant that about 40% of the adults reported that the main source of income, household income, was basically no longer available. That's substantial. On the other end, a lot of informal settlements grew, and that had a couple of reasons for that. People could not afford to pay rental, so they basically left their houses and started to build shacks. We had an extreme large percentage of people moving from formal housing into shacks. People moved closer to services, particularly where food parcels were provided. And on the other hand, there was a moratorium on eviction. Basically means informal settlements were here to stay. For instance, the railway tracks got invaded. If we look at the risk groups, and I would like to talk about a risk group that's probably not so familiar, and that's pregnant women. And the impact, because we worked with pregnant women, we did with the University of Stellenbosch a survey of about 600 women right at the beginning, and we looked at disadvantaged communities. We found that 71% of women did not have an income over the last month before we asked them. A further quarter of all women didn't have any income grant, which basically means they were without any income. What was for us shocking, particularly in Cape Town, was that about 40% of women went hungry to bed and 20% of children. I would not have believed that if somebody would have told me that in Cape Town, a rich city like Cape Town, that 40% of women go hungry. What is also concerning is the level of depression. 30% of the respondents basically were diagnosed with mental health problems. That's the reality. So what does it mean in conclusion? It means the worsening hunger levels and poor mental health have a long-term impact on the development of the next generation. And that's significant. So that's the impact of COVID, of a crisis, onto one target group. If you look at, we spoke a lot about education. In Germany, there's about 25% of grade 4 learners cannot read for meaning. In South Africa, it's the other way around. 81% cannot read for meaning. And that basically wiped out a full decade of development. In 2011, we were there with 82%. Then we increased it, or we reduced the incapacity to read for meaning to 78. We're back at 81%. The shocking, or the interesting news, or the shocking news rather, is that again, it's a divided society. While in schools with the first language English or Afrikaans, i.e. the middle class and rich schools, did not have a decline in the reading outcomes. It is again to the African language schools where we see a significant decline. Those figures should be knowledge, or should be known. South Africa through COVID was basically put back a couple of years in terms of life expectancy. It declined by 3.5 years. Germany, in comparison, had 3.7 months decline. What was the government's response? The government response was, number one, restrictions. You probably know about the hard lockdowns that hit us really hard. A lot of PPE was provided, a lot of communication materials. Second step was to free up hospital beds. We had a very strict alcohol ban in order to get the trauma units clear, and a lot of field hospitals were created. There was an improved service provision, particularly in informal settlements, particularly around provision of water, so that access to water was relatively universal, but a lot of money went into that. Some economic interventions by no means comparable to international standards, but companies could claim a minimal salary cost for employees, and for the middle class, a freeze of mortgage payments, although the interest still occurred. Some social interventions, provision of lots of food parcels, value of 800 rand, but the cost to distribute made the food parcel 1,300, i.e. 2/3 of the actual value of what was distributed was used for transport. The other problem was, obviously, if people see a truck with food, it was seen as a free meal, i.e. a lot of trucks got hijacked and local suppliers were cut out. So there was a double whammy for local communities. A COVID grant was introduced for the poorest of about 19 euros per month. From the civil society, also a lot of food parcels, a couple of innovative stuff, particularly around vouchers. There was a particular voucher which you could redeem at local spaza shops, local shops where you can buy your basic needs via SMS. That was done by the Council of Churches, the DJ Murray Trust, and Flash in Kazan. And we had a very interesting development in Cape Town, in particular, what was called Community Action Network, where affluent communities would pair with low-income communities. There was 135 of those partnerships, unheard of. I would like to draw your attention on the sticker on the right-hand side. There was a lot of social distancing in South Africa. There was a lot of talking about social distancing, a very ugly word if you think about the meaning of it. And those networks actually turned it around, and it said it's around physical distancing, because it was important to physically be away from your potential spreader, but not a social distance. And it was physical distance, but social solidarity, and that was really lived by those communities. And there was another interesting element, that was the Western Cape Food Forum, to look at what is the justice of food provision in Cape Town and Western Cape. So on a neighborhood level, obviously we also start with Apple, with food relief. So while we were checking what we got quite a bit of resources as a well-resourced NGO. So we had our physical buildings where the Department of Health would do vaccination and testing. We had a Wi-Fi network that we basically provide, and I will talk about that a little bit later. And we obviously had information material, but we started at scale with providing food for particularly ECD children. And it really started off, as you can see, with apples and a couple of nutritional food and training materials, because kids did not have anything to train on. So we actually gave each family a plan. What do you do throughout the day for your children? And a couple of exercises, which you can see, basic stuff, reading, some exercises, some creativity, as you can see. So we provided about 4,500 food parcels in that particular community of about 30,000 people through the early childhood development centers. That moved then into, or morphed into, testing the basic income grant. While government was giving the 350, there was no reason why 350. We basically looked, what can you do? And it really started the program towards building a community circular economy. How can we restart an economy? We looked at particular vulnerable and risk groups. Surprise, surprise, pregnant women was important, children below 7, ECD teachers, a sector that did not receive any support from government, and then the general needy population through food kitchens. We based our approach and the value of our vouchers against the food poverty line. So you need about 2,100 calories per day in order to reach the food poverty line. At that time, it was 561 rand. It's well above 700 rand by now. And therefore, communities or members would get of the community would get 2 vouchers at 300 rand per month. So every 2 weeks, they could basically buy the food that's required in order to reach the food poverty line. And we looked at context. I spoke about context at the beginning. So the context that we obviously working from was in a community, was around inclusion in the community, partnering with the community, being accountable, and we had good information of the communities. And then obviously around early childhood development, around pregnant women, our target groups, and then the protective factors, your urban gardens, your food kitchens, your vouchers, and we included spaza shops. Very important to include them because they're often run by foreigners, and foreigners were pushed to the side, and suddenly the foreigners who are seen as a problem became the solution, part of the solution. So it was also around integrating different cultures. And the Wi-Fi network we put up in order to push information through and allow people to communicate. So we're working in the poor areas of Cape Town, the areas of exclusion, and we worked in those 8 neighborhoods which are highlighted here. Some of the results, it's almost 125 million rand that we basically distributed in communities to about 30,000 beneficiaries over a year, close to a year. We installed about 100 Wi-Fi hotspots, primarily in informal settlements, following the early childhood development. We created 200 food kitchens, provided about 16,000 meals a day. That resulted into about 8 million meals over the project period. 143 spaza shops were our partners, and we gave a cash injection in each of the community of about 400,000 rand per week, which then started to circulate, obviously. And a lot of women were provided with vouchers. So a total of 253 ACDs were supported, a little bit with infrastructure, and gardens were restarted. 68 gardens were restarted because there was a lot of vandalism during the hard lockdown, and we restarted the gardens. So obviously so far, what I've shown you is a lot of pushing in from the outside, and the question was, how can we make that sustainable? Because currently it was our funds, funds from the German government, funds from the South African government. How can you make it more sustainable? And it was actually also get the community to self-determine. So it was around generating now an income to stand up for yourself and your community, and it's pivoting the public employment program into social work. So what did we do? We spoke to the presidency, and we said, is it possible, instead of giving grants, giving work to people, so that people can actually see it as self-earned funding? And we spoke to the city of Cape Town. We were lucky. We then got 1,965 jobs plus the core staff members. So we're sitting at 2,100 people right now. It's around building the social capital. Because the idea was to give to 1% of each of the households in the communities we work a job, so that they can basically you can build that social capital. It's around interdisciplinary and multi-sectoral neighborhood approach, as you will see, and it's creating livelihoods. So same exercise, the communities have not changed, the contexts have not changed, and then we looked now for jobs, so early childhood development. We looked into data collectors. We looked into food production. We looked into informal traders. We're supporting the extension of the Wi-Fi network. Organic waste came as a new thing because we felt the circular economy. You can extract the organic waste, put it into compost, and put it into food production. And obviously also around safe spaces, around placemaking, repair, maintenance. Last but not least, the community safety. So I would like to give you 3 quick examples before I close about how we responded, what are 3 interventions. It's the bridging the digital divide, it's the nutrition, and it's around the quality of learning. So when we started, we had 9 Wi-Fi hotspots in those 2 communities, which I'm zooming in, Harare, in Khayelitsha with about 50,000 inhabitants. It's a formal township. Momo BC Park, which is a large informal settlement, grew, doubled over COVID to 30,000, and it's informal. So we had 9. Then during the first phase, during that basic income grant phase, we extended it to 73. The 55 ECDs in those 2 areas got Wi-Fi hotspots, plus some stepping points in between. And now we have densified that over the last couple of months in the informal settlement, because the need is higher there, where we now got in total 146. So those are user numbers since January 2021. So we started off with 10,000. We are now at 35,000 users. And you can see those two points of expanding the network at around June 2021 to the 73 and then the 146 in March this year. But you can also see 2 dips in there, and they are around the Christmas period, January, February, usually of the year. So it shows you, number one, that we deal with a very mobile community. People go home, i.e. leaving town, but also our staff is leaving home, meaning not all of the Wi-Fi hotspots were working. So that's why that gives us a lesson also. How can we ensure that throughout we have the maintenance of the facilities that we provide? Food distribution, you are familiar with the apples for healthy minds. The food parcel I've spoken, and then we pivoted to the vouchers. In those two communities, we basically issued close to 60,000 vouchers in the 55 ECDs that are there, and you reach close to 3,000 children and 310 teachers. And remember, that's over a year what we invested there. But we also linked the food gardens. There are 7 food gardens in the area, which we supported, as you can see. And what we're doing, we buy the produce of the food gardens, and you can see it over the last 18 months for about 153,000 rand. And the food gardens are actually providing the ECDs now with meals. So we're starting that relationship between the local food production and the local ECDs. You can see the intention is to create a local market. Obviously to keep the money in the community. Currently we're financing that, but hopefully we can promote that to other funders. So you can see close to 25,000 meals have been provided. That's really unheard of, that you have that sustained for a longer period, that you connect to resources in a community, and that's really what the circular economy is about, the community circular economy. Looking at early learning, the last example, and that's the quality. So we invested a lot in early childhood development. To remember, we got only 19% that can read 4, meaning in grade 4, and the ECD is about 4 to 6 years away from there. So we want to see at the next in 5 years, we want to see an improvement of the 19%. So it's 2 things that we focus. Number one, it's the place of learning, so it's infrastructure, and we've got a menu, as you can see. And remember, Harare, the northern part is the formal, and the southern part is the informal. So you can also see that the offering varies. Obviously, in informal settlements around sanitation, and it's around fencing to protect the area and to provide sanitation, which in a formal area you would have. In a formal area, it's more leaning towards ceilings, etc. But everybody got the VNet Wi-Fi. And the second element besides infrastructure is obviously people. So how did we pivot the vouchers into jobs? We basically offered each of the ECD 2 jobs, 2 salary subsidies for 2 teachers, and they got two tasks to do. One task is to understand how many kids and what kids are in the ECD, so track the daily attendance. And the second one is to look at the dosage, if we come from a public health perspective, of the curriculum. What is taught to the children, because that also matters. So that required obviously a lot of mobilizing with the local ECDs and the ECD forms, a training, because we do everything via cell phones, via digital systems, because we got the Wi-Fi network, via doing it on paper, was a training of the ECD teachers. And it was also to implement. So each of those children, and you can see the book here, got a QR code with their name and some personal information. Each teacher got a QR code, and each ECD got a QR code. And that really allows you to create profiles to see where do we need to invest. So when you started in July, 0 response. But after training, look for the blue ones. The orange ones are non-reporting, and the blue ones are reporting. So we started off in August with 56 classes, meaning 4 hours of teaching blocks with 89 children and 13 teachers, and we grew it. It's now April, and this is May. So if you look on the longitude, so you can see we started off in August with 7 ECDs reporting with the 89. And we moved up in May this year to 24 ECDs reporting 984 children. If you look at the distribution of the curriculum, you can see it's fairly equal, or balanced rather, which is really good. We got 5 elements of the curriculum, of the national curriculum, and we want to know what is taught in each school. If you compare, if you basically now combine the two, because I've only given you the Harare figures now, if you combine the Harare and Momobisi Park, remember about 70,000 people living there, both consolidated from July last year until May this year, close to 5,000 classes with 2,600 children and 166 teachers. So what does the figures tell us? We only could have a maximum of 104 teachers, but we got 166. So it tells us, and we had a lot of turnover, it tells you that about a third of the teachers turnover in just 1 year. What does this do to the quality of the education for the children? If a third of the teachers basically changes. We got in both neighborhoods about 4,500 children that we know from the census. We reach about 60%, which is very high for South African standards. And during COVID, we had 2,900, we reached 2,600. So very close, we reach pretty much the same number of children. So it's the first time what we created that we have a database that allows us to collate a child profile, an ECD profile, and a neighborhood profile for early childhood. That actually is a very good information to tackle the education crisis, but also tells us where do we need to invest, what resources do we need to invest. In conclusion, I hope I was able to tell you how planting an apple tree in the wake of a crisis leads to a leap forward in early learning. Also how moving from a social distancing to a social solidarity enabled a journey towards an improved quality of life. Some of the examples that we did, we created the largest community Wi-Fi network in Africa actually, and starting linking it to migrant jobs. I didn't talk about that. We created a local market for urban farmers to offer nutritional food on a neighborhood level. And we introduced a data-driven M&E system for early learning to invest now better resources on an evidence base. As a byproduct, but it's not really a byproduct, it's a reality as an outcome, we created 75% of the jobs for women. And that means we enabled starting economic independence for women. Our plan is to codify the task to change the public environment, public employment in South Africa. So we're currently writing a manual, what are the job descriptions for the particular jobs we offer so that you can replicate it. We're busy expanding the Wi-Fi network to another 10,000 households. We're busy training other civil society organizations to do what we do. And we're looking for partners to scale it on a national level. So the upscaling is imminent. Thank you very much.
Thank you very much, Michael. I'm still emotionally shaken, I would say, especially by the first part of your presentation. The statistics that you showed for me were shocking at times, but I'm also moved by the hope and by the first successes of your program, of your interventions. So beside the shock, there is also satisfaction. It was really a moving presentation. Thank you very much.